If you are like the rest of Americans, you are probably afraid and tired of hearing the gloom and doom news about the coronavirus. The airwaves are filled with news about corona apocalypse. Contrary to the headlines in the mainstream media, the first case of coronavirus happened on November 17, 2019, not December 2019, when a 55-year-old from Hubei province contracted the virus, according to a new report from the South China Morning Post, citing unpublished Chinese government data they obtained. At Tech Startups, we've been covering the novel coronavirus COVID-19 since early January. Our coverage is more focused on the work the science community is doing to combat the deadly virus that started back in December 2019 at the seafood market in Wuhan, China. However, instead of hearing more about the works many research organizations are doing to find a cure for the virus, the media spends most of their time exaggerating the impact of the virus, endangering lives and causing panic and anxieties. Yes, coronavirus is lethal and 10 times more deadly than the regular flu. But that does not mean there is no silver lining in the midst of despair. Scientists and researchers are daily making progress in finding a cure for the virus. Below are some of the good news the media is not telling you about. We plan to update the list as the news breaks. Tuesday, March 17, 2020, Israel biopharmaceutical company Kamada is developing a passive vaccine for treatment against coronavirus. Kamada, an Israel-based biopharmaceutical company that is focused on plasma-derived protein therapeutics for the treatment of individuals with rare diseases, today announced that it has started to work on developing a blood plasma-derived treatment against the virus. The Rehovot, Israel-based biopharmaceutical company, said it is working to collect plasma in different facilities from people who have recovered from the viral disease. Tuesday, March 17, 2020, clinical trials for COVID-19 are expected to complete by the end of April. There is more good news this afternoon that the results from clinical trials for COVID-19 could start to roll in any day, with antimalarials coming through first, according to a report of BioCentury's analysis of study completion dates in public databases. Based on the data obtained from clinicaltrials.gov and chictr.org.cn, clinical trials for COVID-19 are expected to complete by April 2020. Monday, March 16, 2020, a new academic study reveals over-the-counter anti-malaria pill chloroquine may be highly effective at treating coronavirus. According to a new academic study presented by Thomas R. Broker, Stanford Ph.D., James M. Todaro, Columbia 1500, and Gregory J. Regano, ESQ, in consultation with Stanford University School of Medicine, UAB School of Medicine, and National Academy of Sciences researchers, shows that over-the-counter anti-malaria pills chloroquine may be highly effective at treating coronavirus COVID-19. Monday, March 16, 2020, NIH has begun a clinical trial of an investigational vaccine for COVID-19. A Phase 1 clinical trial evaluating an investigational vaccine designed to protect against coronavirus disease 2019, COVID-19, has begun at Kaiser Permanente Washington Health Research Institute, KPWHRI, in Seattle. The vaccine is called mRNA-1273 and was developed by NIAID scientists and their collaborators at the biotechnology company Moderna, Inc., based in Cambridge, Massachusetts. The Coalition for Epidemic Preparedness Innovations (CEPI) supported the manufacturing of the vaccine candidate for the Phase 1 clinical trial. A new preliminary study shows that the coronavirus epidemic may be slowed by warm weather. A new study conducted by Chinese researchers shows that high temperatures and high humidity reduced the transmission of COVID-19. If true, the warm weather would bring the much-needed relief while we are waiting for the coronavirus vaccine, which is still about 12 months away. In a paper published in Social Science Research Network (SSRN), a repository and international journal devoted to the rapid dissemination of scholarly research in the social sciences and humanities, Chinese researchers investigates how air temperature and humidity influence the transmission of COVID-19 and analyzed how the epidemic evolved in various Chinese cities taking into account the weather in each. In February, we published a story when Israel scientists announced a breakthrough in coronavirus vaccine in the upper arm with doses given 28 days apart. Kaiser Permanente Washington Health Research Institute announced today it has received a green light from the government to begin its vaccine trials, the first of its kind. Its research team is enrolling 45 healthy people ages 18 to 55 from the Seattle area over the course of 14 months. Chinese scientists say coronavirus vaccine may be available and ready next month. As we reported last week, Zhang Zhangwei, China director of the Science and Technology Development Center of the National Drug Commission (NHC), announced that the country is making progress and that a new coronavirus vaccine may be ready for emergency use next month. Zhang said that a new synthetic messenger RNA, or mRNA, nucleic acid vaccine is the leading candidate for a vaccine to combat COVID-19. Doctors in India have been successful in treating coronavirus. Combination of drugs used, Lopinavir, Retonovir, Oseltamivir along Chlorphenamine. They are going to suggest some medicine, globally. Elderly Italian couple currently undergoing treatment for coronavirus COVID-19 at a hospital in Jaipur have been administered a combination of two drugs, commonly used controlling HIV infection. This is the first time that this combination has been used to treat the deadly virus amid mounting cases in India. Following the success, the Drug Controller General of India (DCGI) had approved the restricted use of the combination of medications Lopinavir and Retonovir, which are second-line HIV drugs, before they were administered to the elderly couple. Researchers of the Erasmus Medical Center claim to have found an antibody against coronavirus. A team of 10 scientific researchers from the Erasmus Medical Center in Rotterdam and Utrecht University says they are the first in the world to discover an antibody capable of fending off infection by the COVID-19 variant of coronavirus. The discovery could lead to an antiviral medication and the ability for people to test themselves at home for the presence of the virus. I am too old to jump on a table, said cellular biology professor Frank Grover to Erasmus magazine. Their article is undergoing a peer review by other researchers on the online platform biopharmaceutical. They believe it will then be published by the top science journal Nature. A German biotech company has developed coronavirus test kits with formalin tests since the outbreak began. Global Science labeled GmbH is a technology company you probably never heard of. Since 1990, Global, a Berlin, Germany-based biotech company that has developed tests for ailments ranging from swine flu to SARS. Dr. Lant and his team have produced 40,000 coronavirus diagnostic kits, enough for about 4 million individual tests. AIDS Foundation, Wellcome Trust and Mastercard joined forces to launch a $125 million Therapeutics Accelerator to combat coronavirus COVID-19 epidemic. Bill and Melinda Gates Foundation announced that it is joining forces with Wellcome Trust and Mastercard to create the COVID-19 Therapeutics Accelerator to identify, assess, develop, and scale up treatments to the epidemic. The goal of the new initiative is to speed the development and access to therapies for COVID-19. A network of Canadian scientists are making excellent progress in COVID-19 research. A San Diego biotech company is developing a COVID-19 vaccine in collaboration with Duke University and the National University of Singapore. Plasma from newly recovered patients from COVID-19 can treat others infected by COVID-19. In addition to the progress being made in the scientific and below is additional good news about life. March 16th, Defense Secretary Esper announced today that U.S. military will provide 5 million masks for a strategic reserve to help slow coronavirus outbreak. 1 million will be immediately available. Defense Secretary Esper March 16th, Amazon is hiring 100,000 new full-time and part-time workers in the U.S. to keep up with the demand. The online giant announced it is hiring 100,000 new full-time and part-time 100,000 workers to keep up with online shopping surge caused by a surge in online shopping. China has closed down its last coronavirus hospital. Not enough new cases to support them.